I get home, I pour a little glass of wine, play some music, and cook. Now, I could spend literally half an hour cooking, but to me, I've done three things that I like in that half an hour.
Ladies and gentlemen, welcome to another episode of the Rhinoplasty podcast with me, Dr. Cameron McIntosh. We're in the month of June, and the theme for the month is the evolvers, those guys who have over the years evolved even when faced by new techniques, etc. And this is brought to us by Vectra from Canfield Scientific, this 3D camera system, which I think is marvelous. So shout out to Vectra for enabling this. On today's show, we have a remarkable man. It's a great honor to welcome Alwyn D'Souza all the way from London, UK. Alwyn, thank you so much for being on the show today.
Thank you very much, Cameron, and thank you very much for your very kind invitation and introduction. Great to see you.
Yeah, it's great to see you, Alwyn, and it's great to chat. There's so much stuff to talk about. So, just to kind of put in perspective, I want to, for the listeners to realize who they're speaking to, is your days of editing one of the foremost international journals. Tell us a little bit about that.
Right. Okay. So, as you already said, it is a fantastic journal. Focuses exclusively on facial plastic surgery, and I think academics is something I've had a lot of interest in always, and my interest always has been actually, getting that kind of academics in the public arena that is useful for people. Yes, there are lots of basic science research journals and things like that, but our journal is unique, and editing this journal is not easy, simply because you often have to refuse manuscripts from your close friends. And they don't like it, But I think fairness is the policy here. So I love what I do. It does take a lot of my time. And I think any spare time I used to have is gone with the journal. But nonetheless, I think it's probably the most rewarding thing that I'm doing now. So great opportunity.
So I'm sitting on the other side of the fence. I've got to try and get the potential papers to you. But yeah, sometimes it's so difficult I find it to motivate myself to, I want to be operating and spending time with patients, but you have to publish as well. How do you guys, it must surely be frustrating as an editor at times, working with us plebs who are trying to publish, because you've got guys who are pushing for publications, and then on the other hand, you've got guys who have been accepted, but they're not doing the work. How do you manage those two?
Okay, I think it is organization, and it is being clear in terms of what you want. Now, I love seeing my patients, but I do set time aside, and that time aside is just for the journals. That is one thing. But I think the most important thing is having that organization and making sure you stick to your lines. For example, when I get new fellows, they are told that they have to have so many publications, and the ideas come from me. And I think, Cameron, what is important for all of us to understand is some of us are good at publishing, some of us are good at planning, some of us are good at executing things. So I think for me, I know that personally I can plan things, I can come up with ideas, but I need someone to execute my ideas. And that is where you have to be very clear as to how you do it. So you got to get after people a little bit. But when they see the reward at the end of it, they love it, But it is discipline. It is engaging in what you want to do well and enjoying it. If you don't enjoy it, you can't do it.
Okay, so shifting a little bit from that role, another massive role that you run at the moment is being the president of the European Society facial plastic surgery. How did that end up? How did you end up in that role? Should I ask?
Right. Okay. So just to go back a little bit, I trained in India, and from India I moved a leap to the UK, and the idea was get my FRCS, and then move on. So once I came to the UK, obviously I met my partner, who I'm married now, and then we settled in the UK. But the bottom line is, how did I get into facial plastics? Now, if I can say this, that I think if I was not a surgeon, or if I was in another country where I had a lot of training in art, I probably would have become an artist, you know. So that's the bottom line. So because I became a doctor, and I always loved art, and I looked at, and I must say I've been a pretty good surgeon overall. It's not my own making, but it's what my trainers have said to me. So I thought, okay, I want to create something artistic. So then I went into visual plastics, and I have I did a little bit of training with Vito Cotella at one stage, and he said to me one day, Alwyn, if you wait long enough, the things that you want, they come to you, but you got to be patient. So I've been waiting, and a time came when it was, I had to run for some elections, and luckily people actually chose me as the president. And I think, but behind that, I had put in years of work, so it's taken a long time, but I'm enjoying it completely. It is not the easiest of jobs, simply because, again, it's you got to work with other groups of people, other surgeons. You also got to look after your own. And I think the bottom line is, you got to be fair in this game, And I hope that most people who have worked with me know that I'm quite fair. And I do say things sometimes people may not like, or sometimes they like what I say. But I think generally, it is a hard one, but it's an absolutely enjoyable one. Running for the elections was the hardest part, because, that's when you think, if I don't win, am I going to be able to swallow this? But then that's life.
Well, I'm glad you won, because I'm such a proud member of the society. I think it does so much work. Eh? So, this podcast's going to 70 countries around the world. Give a pitch now on why and how people should become members of the society.
Okay, right. So now, a few years ago, and my dear friend, and I would say a fantastic colleague, we all know, Fazila Pardeen, set out to literally transform the facial plastic surgery, in Europe. The European Academy of Facial Plastic Surgery, I think, transformed with him taking over. The first thing that he did, and we did, and I think we had a good group of, people working together. We thought the first thing is the education. And as you know, we uploaded a number of videos. Frankly, Cameron, that you don't need to buy a textbook if you're a member of this academy. And without overstating, I think we have more educational material on our website than any other facial plastics surgery society. I won't name the society, but it is true. And moreover, in my last newsletter, I said what we want to is load more. And one more thing I want to also mention here is, for all the members or those who want to join, it's not about watching the best surgical procedures done in the most perfect manner. And I'm asking now people to load on videos where we sometimes don't get things completely right, but we learn from those mistakes. And one of the things I'm doing is, getting those kinds of things in. So it's going to be an ongoing education. And my next role also is that I want to set up those videos in such a way that we have the basic ones, we have the intermediate, and the advanced ones. So, like I said, you will not need a textbook. You don't have to buy CDs. You don't have to, and you can actually watch those. And moreover, we will also have a channel where, if one has a specific question, let's say, Cameron McIntosh does this technique in a particular way, and somebody watches it and they don't know how you're doing that, we would ask your permission for the person to contact you and say, Dr. McIntosh, how do you do it? Can we actually, learn this from you? So those are the things. So in other words, I want to make this society more, easily, reachable for everybody. And certainly those well-established surgeons, can be reached by anybody across the world, no matter how junior or how senior you are. So no one feels left out. So, and I think that is the ethos, with our society now, and with the academy. I would like people to join simply because of that. And then remember, you get your meetings at a reduced rate, you get journals at a reduced rate, and you have number of videos. So I think there's nothing particularly lacking, and if there is something lacking, I would be very interested to hear from anybody so we can fix it.
That's awesome. Old Fazil had a huge impact on my career and on rhinoplasty in South Africa. He was our founding international godfather, if you want to call it that way. So it's great.
Yes.
So, I mean, these are two huge roles: editing international journal, the president of the association. Another massive part is your clinical work. But before we chat about the clinical work, because I've got a few questions around that, is there two things I want to touch base on. The one is, how do you find balance in your life between all this stuff? And kind of very closely related to it is, what do you do for downtime? Because you can't be carrying on like this. We have to rest at times and do other things. So how do you go about that?
Right. Okay. So let me come to the downtime first of all. I love music. Okay. I love a nice glass of wine, and I love to cook. So I can do all three, so if I get half an hour, and typically, sometimes I start operating at 7 o'clock in the morning and I finish around 7 o'clock in the evening. I get home, I pour a little glass of wine, play some music, and cook. Now, I could spend literally half an hour cooking, but to me, I've done three things that I like in that half an hour. So I've relaxed for 1.5 hours. And on those days when I'm really, really tired, Cameron, I think before I start anything of this sort, I need a good glass of water, and I do 5 minutes of rowing, literally 5 minutes. And now I'm not a rower at all, but it really, for me, swimming and rowing are two, exercises or two activities, I think, that are non-impact activities, because I've got a slightly, ankle that it can trouble me sometimes, and rowing does great. But it's only 5 minutes. I don't claim here to be, doing anything more than that. So for me, you see, within that half an hour, 40 minutes, I've done three things that I love to do, which means I've relaxed enough. So, and hopefully I'll get more time to do these things in the future. And again, one of my passion, and probably eventually I might write a book on cooking and the facial plastic surgeon.
And I'll be the first one to buy it. That would be great.
Yeah. So, but that will come not in the next few years, but it's on its way at some stage.
You know what you should consider doing is getting some of the guys from around the world to add recipes to something like that. Because, you guys, the society has, I don't know, how many nations belong to the society? Members do you have from how many nations?
I think we got a large number, Cameron. I don't have a figure at hand, because we have literally every I always say east, west, mid, everything. We have obviously we have South Africa, we have India. We have Australia, we have United States, we have the Middle East. I think, we have a large number.
The Rhinoplasty cookbook, or the facial plastic surgery cookbook.
Right.
That's great.
Yeah.
Okay.
Yeah.
Let's get now dig deep into some clinical stuff. And off air, we were chatting about two things. So try and explain, I need to understand, and our listeners need to understand, what is a signature nose?
Right. Okay. So I think if you look at it from the traditional sense, and I see this a lot in London, when I look at noses, you can pretty much tell who has done that nose. In other words, either a ski slope, or a defined tip, or you have an ala that has been reduced, and they all look beautiful. But it is literally, there are surgeons who create a particular type of nose. I think for me, I have moved away from that a long time ago, and I think for me a signature nose is a patient's own nose. In other words, what the patient wants. Granted, sometimes you have to educate the patient, saying that certain things they ask for are either not in their best interest or they can't be achieved. So for me, the signature nose is a nose where when the patient comes to me, I ask them, what is that one thing that you really don't like about your nose? And I try and deal with that. Now, typically, when we speak to surgeons, and this is across the board, I guess, we all talk about at meetings, the radix angle is not right, this is deviated, or the ala, one side is slightly bigger than the other, and all that is fine. We can talk about all those deviation, all those minor irregularities. But to me, a signature nose is a nose that the patient wants, and the nose that fits the patient's face. And I think that is absolutely crucial. And I guess I've come to this conclusion, Cameron, not so much because I don't believe in all these aesthetic principles. It's mainly because of the population that I work with. London is a very mixed, population. I have people, obviously, the sort of Caucasians, we have the Indians, we have the African noses, we have every type of nose that you can actually think of. And I think we have a bigger mixture of possibly any other place in the world, And for me, I actually see patients from all, ethnic origins, if you like, if that's the right term to use. But the signature nose for me is it has to fit that person's face, and I think there's a skill in doing that, and the skill is, first of all, understanding different population as to what they like and what they don't like, and sometimes educate them that an Indian face will not handle a typical Caucasian nose well.
Yeah.
So
But that's also closely related to the other topic we're speaking about, is the skin soft tissue envelope. Forget about just what the nose looks like, but I mean, the skin has such and I think sometimes it's something we don't speak enough about in our meetings.
Absolutely. And look, the first thing that I say is that every bit of aesthetics, we talk about, how the skin looks, what the face looks like, what the nose looks like. A lot of it is based on actually taking people's photographs. So you take a photograph, the first thing people look at is the photograph. How do I look in the photo? And more so now with zooms and things like that. So now, how your nose looks is very much dependent on how the skin reflects light, because it's what the camera sees, and camera sees the light. So for me, I think typically managing the skin in nasal surgery is absolutely crucial, and I think we don't talk enough about it, and I think it's because we don't know enough about it. And I think as surgeons, we need to understand the skin and how it works. Now, how did I come about this? I'm very passionate about skin and what is under the skin, apart from the bony and cartilaginous structure. I mean, I'll give you an example. We could take a piezo and we can polish the nose really, really, really nicely. You can get it very refined. But if your skin has got lots of sebaceous glands, it's wasted effort. So I think the important thing here to understand is it's like having one could go and buy a Ferrari. If you don't polish that Ferrari, it is never going to look good. If you park two Ferraris, that are brand new, one is not polished and one is polished, everybody will look at the polished one. You go to a showroom, everybody looks at the polished one. You look at the red carpet, the celebrities, the first thing they do is they go and have a little bit of probably radio frequency treatment on their face, on their nose. So I think polishing the skin is very important. And also, it is not just how the skin works in terms of lighting, in terms of camera, and how we look. The skin also has got a significant effect on how our nose moves. For example, if one has a completely deviated nose, I use botulinum toxin to actually paralyze the muscles around the nose. And I say to my patient, you will look like a bit like a mask face for a while, and we might have to do that for almost 1 year. Because I think it is important to understand your muscles are used to pulling your nasal bones and your nasal, cartilages in a particular way. They are attached and they pull it in a particular way. Now, if you have changed that direction and you got a nose straight that has been bent, unless you paralyze those muscles until such time that your underlying skeleton, gets a bit more stable, you are going to see this recurrent deviation. And in my opinion, often that is the reason why people notice this deviation, people notice these changes long time after. So I think there's a lot to be said about it. I could go on talking about it for a long, long time, but I often feel that, managing the muscles, managing the skin is very important, because that's what pulls. Because, if, for example, if you have an injury on your elbow, you can see the contracture, but in the nose, underlying, you may not see the contracture, but you got to deal with it. You got to anticipate what you're going to get from it, And I think that is important for me. That's why SSTE, is very important in my opinion. And I spend a lot of time. I use various things, starting from, creams, vitamin A creams, lasers, sometimes radio frequency, a lot of botulinum toxins. I use all of those,
And that is fascinating. This is what's so interesting. So, okay, let's focus on Botox and the nose. Is this now pre, peri, post-operative? And I'm just putting it out there. Is this only on deviated noses or across the board on your rhinoplasties?
No. Okay, I'll give you a straight example here. Somebody has got a person, we are trying to augment a deep radix. What do? We put a radix graft. Okay. So let's think which muscle has got the biggest influence on radix. That is the procerus, and possibly nasalis, but mainly the procerus. Now, if you have a strong procerus, you can put the radix graft, and yes, we can say that we will stabilize the graft, we will put it, under the, periosteum or wherever, or bury it in the muscle and whatnot. But, we all know that radix grafts move. Why do they move? Because, we talk about actually, if you look at the books, people will say, oh, yes, you've done a radix grafting, tape it for 10 days, leave the tape for 2 more weeks till you actually, but 2 weeks is not enough. So you put a good bit of Botox in that. All that patient gets is a paralyzed procerus for about 3, 4, 5, 6 months. But by then, your graft is solid in place.
Yeah.
It just stays there. Okay, so that's one area where I use botulinum toxin in a pretty big dose. But it is a large dose, but it's a highly concentrated amount, so you don't get Botox going everywhere. It's a small volume, but a large dose. And when I'm talking about large dose, I'm speaking probably even 30 to 50 units, depending on the muscle bulk, which is not what I use in aesthetic, foreheads. The other thing, let's now take the other situation where I have, let's say, typically, or African or a Chinese origin patient who's got a flat nose, want their nose lifted up a little bit. So I go and put a graft that goes right from the radix up to the tip, elevate everything. They come to your clinic and then they say, this looks great, but I don't like this bulk, because what you've done is you elevated partly the procerus and you've stuck your graft under there, and now your procerus is higher than it was before. And typically what they get is almost like an angry face to the procerus. Now, in those cases, I put the Botox, again, large unit of Botox, and that putting the Botox in generally, gives you some muscle atrophy. I might have to repeat it. So those are 2 very classic examples.
It's fantastic. Yeah.
And we don't talk about this. And it's, why we don't talk about this? Because a lot of us don't know much about it. And as you probably know, I do a range of things, and it's something that I'm very, very passionate about. Same thing with, alar flares sometimes. Even if you have divided the muscles, even if you try to correct the alar flare, you want that muscle to be paralyzed for a while when the scar sets in and when that flaring becomes less of an issue.
Okay.
And I think that is important. And patients will tolerate this post-operatively, immediately post-operatively, very well.
So that was my question, is when do you give the injections?
Right. Okay. So I do them during surgery. Because ideally I would like to do it probably 3 days prior to the surgical procedure. Often we don't, either the patients don't come. And we used to do it prior to the surgical procedure. But now, because of the COVID self-isolation rules and things like that, I do it during surgery. So every, augmentation that I do, Cameron, I use a lot of botulinum toxins, simply because, most people won't believe me. I always say I don't fix my grafts. I don't fix my grafts because of a simple reason. I raise a precise pocket when I put these grafts in, but even within those, the grafts can move. And the movement is related. What moves the grafts? Apart from patients' fingers, what moves the grafts is the muscles. And some people have more, and we, so if you buy a book on facial expressions, and you look at what muscles work and how they work, you will suddenly realize I'm missing a big trick here. So that is how I deal, with some of these noses.
Guys, so those listeners out there, this is what the Academy's about. This is a little pearl, an absolute pearl that you can bring to your rhinoplasty practice. So you want to get more pearls, get to the congresses, get onto their webinars and stuff. Yeah, jeez. Alwyn, I'm kind of, I don't know if I actually want to talk more because there's so much to think about. It's great. With cooking, you want to have just savor that. You don't want to have too much. And I think what you've made for us here has been fantastic. Eh? So thank you. On behalf of all the listeners around the world, thanks. Vector, obviously, big shout out to you guys as well. I've got lots more things to ask, but sometimes we need to respect just the little pearls and just like digest them, So, I'm going to make a call on today's show at this point.
Yeah.
So thank you.
Cameron, thanks a lot. And I would like to thank all the, sponsors, because I think without them, this wouldn't happen. And, thanks to you, Cameron, I think you are doing a fantastic job. And what can I say? I always say, Olympic athlete, your stamina is phenomenal and is precious. Keep that up. And, thanks for having me on. And hopefully I'll see you soon in person.
And guys, come back for next week for another show.